This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
For 54-year-old Alfredo Buenavista, biking is not just a sport. He considers it as a vital part of his lifestyle.
Na-disgrasya ako sa mountain bike. Siyempre, form ng exercise na rin yun. So, every morning or at least 3 times a week.
But it was this same sport that led him to a road accident.
So, bali na itukod ko itong kamay ko sa itong thumb. Bali itong kamay ko, pag nakita mo sa x-ray, nagkapatong na yung buto.
Robert was rushed to the hospital. And after treatment, he was also advised by his doctors to undergo therapy sessions to help in rehabilitating his injured arm.
Patients who are disabled are given preventive measures or are managed so that they can go back to their near normal or normal lifestyle.
A therapy like this enhances and restores functional ability to those with physical impairments, disabilities, and injuries.
So, pag nabalian ka, let's for example, na-operahan ka or na-cast yung buto mo, ang goal ng rehab, maaaring hindi bumalik sa dating lakas yung kamay at saka yung paa, pero dapat naglalakad sila o dapat nagagamit nila yung kamay para sa mga pang-araw-araw na gawain.
Robert is now on his last few therapy sessions and he hopes that he can go back to biking soon. How do these rehabilitation programs help improve the patient's recovery? What are the latest medical breakthroughs in rehabilitation medicine? Find out the answers tonight on MedTalk.
Joining us on MedTalk is Dr. Narciso Fernandez, physical medicine and rehabilitation consultant from the St. Luke's Medical Center. Also with us is Dr. Ernesto Henson Nepomuceno, consultant from the Philippine Rehabilitation Institute and Angeles University Foundation. Good evening, doctors.
Good
Welcome
evening,
to the
Angel.
show.
Good evening. Hello.
Rehabilitation medicine. Is it really
Yes.
such a broad topic or an impression that people generally have?
That's right. You know, actually the complete name of our specialty is physical medicine and rehabilitation. So I know the rehabilitation is a general term. So we aim to bring people to normal function or near normal function. Yeah.
It is a branch of medicine that enhances or restores the functional ability or quality of life to those who have physical impairments or disabilities.
And in knowing this, or knowing these, we will now narrow it down for tonight's episode. We'll narrow it down to physical rehabilitation medicine and sports rehabilitation
Sports
medicine. Is
rehabilitation.
this,
Physical injuries. Yeah.
okay, physical
Injuries.
injuries, is this the same or does it fall under one umbrella, the sports injury under physical rehabilitation?
It's not, well, it encompasses, physical injuries encompasses sports injuries and other, like for example, natapilok ka or ano, but it can also include trauma. Like for example, you fell, diba? Not necessarily from a sport.
Mostly musculoskeletal.
So from the minor to the very major
That's right,
physical
that's right.
Rehabilitation medicine,
That's
therapy,
right.
that,
Therapy,
that
yeah.
one may need.
Yes.
So let's describe what physical rehabilitation medicine is, what is it about, and what entails, what does a patient go through when one is in rehab?
Okay. So like I said, physical medicine involves physical therapy. Physical therapy is actually just one aspect of rehabilitation.
Okay.
Okay. So we aim to bring these patients who are injured, whether from sports or trauma, to bring them back to a normal function and reduce their disability.
Okay.
So it has many subspecialties. No? We have palliative medicines that address the pain due to injuries. But I think for tonight we will be more dealing more on physical injuries, which is more skeletal injuries.
Yes, we'll be talking about that.
I
What
think
are
what you mean.
physical rehabilitation doctors like you called?
So
We're called physiatrists.
Physiatrists.
Yeah.
Physiatrists.
Yes.
more of
Okay.
physiology, function,
As opposed to a physiotherapist. A physiotherapist is a physical therapist.
therapist.
The rehab doctors are called physiatrists.
Okay, as physiatrists,
Yes. Yes.
what medical conditions or injuries does rehabilitation medicine need?
Okay, well, we have a lot of, we get a lot of patients from, like, for example, like I said, sports, no? When they sustain injuries from their specific sports, okay, and also from trauma, like, for example, fractures and sprains and strains. So it actually encompasses a lot of injuries.
Okay.
So
Yes,
it's not
Dr.
just
Fernandez.
injuries, no?
Yeah.
Post-surgeries, like
Yes.
for fractures, post fixations, or repair, construction. Usually the orthopedic surgeons refer it, the patients to us for rehabilitation.
Okay. So I mentioned earlier there are minor and major. Maybe we can go through the major, the minor first, the
Minor first, okay.
injuries
Yes.
that may require physical therapy.
Yeah, minor
Physical
injuries include.
rehabilitation.
Yeah, minor injuries include like sprains and strains. You
What's
know.
the difference between the two?
Okay, a
Sprain and a strain.
Yeah, that's right. Well, aside from the spelling.
Okay.
Yeah, a sprain usually is an injury to a ligament. Okay, it's a tear. Okay, so it's even graded. It's grade 1, 2, or 3, depending on the amount of fibers that were injured. Okay, a strain is usually an injury to a muscle. Okay, it's also graded. Grade 1, 2, 3, something like that.
Is there any physical manifestation of a strain and a sprain? Because if I may say so, I remember I had like a, now I know it's a strain.
Strain.
I
You strained your
couldn't
back.
move my, yeah, I strained my
Okay,
back and,
yes.
and
So it's more
it's
of
really
a
painful.
anatomical site. We can differentiate the sprain, the strain. I mean, yung part ng katawan ng tao. So mostly the strains are muscles. So joints, mostly sprains. And,
Okay.
And then, like,
both
yeah.
of them presents with pain
Yes.
and
that's
loss
right.
of motion. Okay.
And then there's also swelling. There's hematoma. Okay, when you see hematoma, the black and blue, diba? Or but most of the time it's swelling. Swelling.
Okay, so when there's swelling,
Yeah.
that's the sprain or the strain?
It can be it can be both.
Both.
Okay, but strain usually it's a hematoma.
Okay.
But sprain can also produce hematoma, but there's also swelling.
Is there an immediate need to go see a doctor?
Yes, because sometimes, as Dr. Nepomuceno said earlier, for example, sprains, no, there are different grades, grade 1, grade 2, grade 3. Grade 3 involves fracture already. Grade 1, it's just hematoma, swelling, maybe some small tear of the ligaments.
Okay.
Grade 2, bigger swelling, I mean, and then,
Yeah, more fibers
Yeah,
involved. More fibers are torn.
but on grade 3, most likely there's a fractured
Fractured.
bone already.
Which needs immediate
Immediate
care and
attention,
immediate
because
attention.
yes,
Yung grade 1, can you still do
Walk.
home remedies for that?
Yeah, you can
Yes.
still walk.
Yeah.
While the other kind of injuries, I mean the grade 2, grade 3, sometimes you need to immobilize the joint, no? And that's where the rehabilitation medicine will come in after the cast or the immobilizer is removed, because it will limit the movement. So the patient cannot function anymore. She used to function before.
Okay, so rehabilitation medicine, as you've mentioned, is bringing the patient back
Back.
to its
Normal function or
Normal
near
function.
normal function as
Functional
much as possible.
capacities, yes.
okay with the help of surgeries.
Yes, if surgery is needed, like for example in severe sprains or let's say there's a fracture
Let's say
involved.
there's a sports injury.
Okay, what kind of sports injury?
Like an ACL. maybe?
ACL.
Yeah.
Kailangan ng surgery talaga.
Reconstruction.
That's why we, like Dr. Fernandez said, we get a lot of referrals from the orthopedic people because post-op, meaning right after an operation, they send the patients to rehab.
Rehab, right.
Okay.
May I add, no?
Yes, please, Dr.
Specifically
Fernandez.
for ACL, no, anterior cruciate ligament, it's a ligament that stabilizes the knee. Sometimes you don't need it to be repaired. It depends on what you do. I mean, if you're a
Yeah.
basketball player, I
Yes.
mean,
That's
if you're
right.
an athlete,
Yes.
professional, you really need it to be repaired so that you can return. It's not as strong as before, okay? But you
Yes.
really need it to be repaired. But if you're just
Yeah,
in an
no.
ordinary office and
Yeah, I was about to
job,
ask if you're
don't
not
really need to
you
be,
don't play
ano.
high impact sports.
Yes,
yeah,
like for example,
physical
you're not a
therapy.
professional
Athlete or
basketball
basketball
player,
player.
di ba?
Yes.
And your career depends on your knee. Of course, you have to have it repaired.
But
no
if you're
matter
not, physical therapy is enough.
what. Yeah.
I mean, rehabilitation is enough without surgery.
Without surgery.
Yeah.
So medicine, surgery, and then rehabilitation medicine.
Yes.
Yes.
All go hand in hand,
That's
or
right.
can
Yeah.
one do without
Oh,
the other?
by the way, Angel, we also give medications. Kasi we just don't give physical therapy. I mean, we also give medications for pain and anti-inflammatories. Okay, and those medicines to control the swelling. Okay, so that's part of the rehabilitation program.
Okay, because there's this thinking that when there's rehabilitation medicine, it's just the
physical
therapy,
therapy.
physical
Physical
therapy.
therapy.
Not a lot of individuals know that medicines also go hand in
Yes,
hand.
yes.
You also give
Yes.
medicines or
Because
recommend medicines.
we're also medical doctors. That's why we have to give
And,
that part.
Not only physical therapy, we also involve occupational therapies, speech therapies,
therapy.
even psychologists.
Yes.
Okay.
Yeah, even sport. There are people called sport psychologists
Okay.
who help us return athletes to full function. Because there are some people who, after undergoing
Depressed.
surgery, like for example, or after undergoing surgery, they feel inadequate to
Loss
go
of
back to their sport.
confidence.
Yes.
Okay,
yes.
so they need sport psychologists to to prime them up to return to sport.
Like what you mentioned earlier, if it's their source of living.
That's right, yeah.
It's,
But
their
if you're
career.
yes, their career
Yeah.
depends on it. No? That's why for ordinary people, like for example, you're just an everyday guy who goes to the office, then you play basketball,
Yes.
diba? Then you injure your knee. They'll give you meaning when you get an ACL, for example, they'll give you an option na parang, oh, do you want surgery for that? Because it's kind of expensive also, unless it's an HMO takes care of it, right?
Right. Oo.
So if they opt for surgery, then after that they can undergo rehab after.
We talk about surgeries, we talk about medicine. Are there other rehabilitation programs that we have here in the country?
Other rehabilitation programs.
Maybe
What
you mentioned something about hand in hand with another doctor, or
Well, usually we're in touch with our orthopedic friends, so they tell us basically, like for example, a fracture might involve putting a pin or a
Yes.
metal inside. Okay, so they're also referred to us after surgery. Okay.
okay. And we can go talk. You mentioned earlier about the cost and all of those things. Later
Yes,
we'll talk
yes.
about that. But before we go to that, we have a question from our Facebook page. Doctors, I fell from my bike and broke my arm last month. I felt better after 2 weeks, so I went back to work. But it has started to ache now. What should I do? We were talking about this
Okay.
earlier.
Okay, when he said he broke his arm, I'm assuming it was a fracture. I'm assuming, right? Because when you say broke, it can be a dislocation or a fracture. It's different. I mean, if there's no fracture or if there's a fracture, totally different approach. Okay, so
Okay, so
What he
with
should
his
do, I
concern,
think,
yeah?
he should see a doctor, even a
Yes.
general practitioner. Then the general practitioner will tell him or her him to see a doctor who specializes on that kind of condition. If it's broken, as Dr. Nepomuceno said, fracture and needs to be operated, he should go see a orthopedic surgeon. And after that, they will refer the patient to us for rehabilitation.
But since he said it was like 2 weeks after that
Yes.
he came back, we're assuming it's not a fracture.
Yeah.
Okay,
Because a
kasi
fracture
able
will
to
take
function
longer. No,
Yes.
a fracture will take longer to heal.
To heal.
Like probably 6 to 8 weeks, something like that, depending on the fracture. Okay, so I assume it's only a soft tissue injury. When you say
Yes.
soft tissue, it's like the muscles or the tendons or the ligaments.
Okay.
Okay.
Yes, you're about to add something, Dr.
But there are sometimes fractures that is not complete.
Yeah.
It's a hairline fracture.
Yeah.
So
Which
it can
is
cause pain.
noticeable after a couple of days.
It's
pa?
pain, but
Yeah.
it's still functional. But because of so much pain, sometimes you cannot really move. But I said, Dr. Nepomuceno said earlier, it's 2 weeks after, it's unlikely that it's a fracture.
Yeah.
He's able to function already after.
Even if it was just a hairline fracture. Yeah.
Still able to function. Now from our Twitter page, doctors,
Yes.
can I have my rehabilitation therapy done at home?
Sure, but it will cost him more. What does he mean? Hiring a physical therapist and have it done there?
Looks like it.
It can be done. Usually, some patients, but these are patients that has neurological problem. I mean, stroke patients. But for those injuries, I mean, what we're talking right now is sports injuries.
Yes.
We prefer them to go to the physical therapy center.
Why is
or
it better to
center.
go to the physical therapy?
We have the equipments there.
Yeah, we have the equipment there, the modalities, right? Di ba, we use ultrasound and electrical stimulation, hot packs, and so initially they have to do it in the clinic or in the hospital because we were able to monitor them there.
Yeah.
Okay, unlike in the house, di ba, if the therapists go there, we're not able to monitor them
Okay.
unless we tell them to follow up with us.
Okay.
Then they should be evaluated first by
That's
the
right.
rehab doctor.
Yes.
We have to identify the problem. If there's loss of motion, there's a contracture, there's loss of strength, it's weak, maybe some sensory problem, we need to know it so that the physical therapist will know what program or what exercises to do.
Okay,
Okay.
so you can't just do it at home. Maybe if the patient's immobile, then
Yeah.
maybe.
Yes,
That's
yes.
why
If
I
it's
said
mobile and
it's
able
a
to
stroke
go.
patient.
So we have to diagnose them first, know what's wrong,
Yes.
and then we can give a rehabilitation program.
Okay. All right, doctors, will talk more about rehabilitation medicine when MedTalk returns.
Did you know that there is a term called telerehabilitation? Using Skype and other widely used online video services, physical therapists can now assess patients with low back pain over the internet. According to Professor Manuel Arroyo Morales and colleagues of the University of Granada, Spain, with the internet technology, telerehabilitation can be a more feasible alternative to in-person clinics.
We're back here on MedTalk, still talking about rehabilitation medicine. Doctors, before the break, we mentioned an ACL. What does ACL again stand for?
It's anterior cruciate ligament. It's a ligament that stabilizes the knee.
Exactly.
It's coming from a bone on your thigh and then going to the bone of your leg. It connects
Yeah.
the bone of your thigh to the bone of your leg. So it prevents from
Subluxy.
from pushing. I mean, of one bone
other.
to the other. I mean,
Moving forward.
So it
yeah.
attaches, it
basically,
anchors.
you can twist your twist your knee and move it around.
Yes.
And the ACL and the PCL, the posterior cruciate ligament, they stabilize the
Yeah.
knee. Okay,
It
so
prevents
once
from moving forward,
the ligament is torn, the knee becomes unstable.
unstable.
Okay, so you're not able to do certain movements like pivoting, or and it can be painful, of course.
The knee is weak already.
Yeah.
Okay.
Yeah, it's not as strong as before.
You're not 100%, in other words. Yeah.
But can you be 100% after rehabilitation medicine or rehabilitation
After
therapy?
surgery, I mean,
Yes,
after surgery, of
surgery
course, yeah.
and then rehabilitation. Just
That's
like
yeah.
Derrick Rose, Chicago Bulls.
Yeah.
Uh,
Actually,
So
that's the athlete's nightmare, an ACL
the
tear, di ba?
ACL,
Parang if they get an ACL tear, oh man, that's probably the end of my career. But actually, it's not. You know, they can do surgery and they can be rehabilitated back to normal or near normal function. I mean,
Is there a certain age? I mean, we mentioned sports injuries, and a lot of kids also play sports.
That's
Is
right.
there a certain age where one can undergo surgery and then rehabilitation medicine? Or if
Yeah.
one is injured in that area, immediately
Yes,
surgically.
immediately. Yeah,
Surgery.
it's actually the choice of the patient. Even if you're 14 or 40 or
Yes.
60, if you choose to undergo surgery, you can.
But
There's no-
sometimes I think they go conservatively on children
The younger
because
ones.
they still grow. And it's the call of also of the orthopedic surgeon,
Okay.
and then also the patient. But
What happens if one doesn't undergo rehabilitation medicine or doesn't undergo surgery?
doesn't undergo with an ACL
With
tear.
an- yeah, let's
Okay.
assume it's an ACL tear.
ACL tear. Yeah. Well, actually, you can still play, but like I said, once in a while it will be painful, and you'll be prone to you're prone to develop arthritis early.
Yes.
Early.
And
So,
then-
okay.
Why is that? Why are you prone to developing
The
arthritis
knee
early
tends
on?
to slide on itself. Slide on itself when it's like I said, it's unstable. So there's a lot of friction. Yeah.
and
So
sometimes
eventually-
they complain of nagbabuckle down yun.
Yes, nagbabuckle.
Tumitiklop.
Yeah.
Bigla na lang tumitiklop. Hindi siya ganun
Yes.
lakas. Especially when going up or down the stairs.
Yeah.
Doon mo may
We
experience.
really need our knees, eh, no?
Yeah,
We
yeah,
don't
really.
realize
And
the
they're scared.
importance of our knees.
Yes.
Sometimes.
And they're scared to go before they drive to the hoop or, or kick to the goal, but they're afraid because they feel that their knee is unstable. Okay, so we help them out with that also.
Okay. Aside from this sports injury, the ACL, what are the other common sports injuries that the
Common,
patients come to
sprains.
complain to
Yeah,
you
sprains,
about?
yeah.
Yes.
Ankle sprains, that's
Sprains, yeah.
probably most.
Tapilok.
Tapilok.
Tapilok,
yeah.
that's tapilok. Sprain.
Okay.
The
Okay,
usual.
and yun, very commonly, di ba? When you get a sprain, people will say, "Oh, step on a bottle," or or make it hilot. That's
Is that
totally,
correct?
No, that's
Also,
very wrong.
cramps, muscle cramps.
Yeah, muscle cramps. yeah.
Okay. So mali yung like for women, when we wear high heels and
Yes.
sometimes we're not able to watch our step, then we fall.
Okay. Yes,
Natatapilok kami. So what should we do?
Initially, put ice on it. Don't put it in a bucket of ice water, not the whole foot. Just put ice on the
As in the
affected
ice cube.
area.
Okay,
Yeah,
okay.
ice cube, a bag of ice, and just place it on the injured part.
Okay.
Definitely.
That's immediately.
Immediately, yeah, immediately.
Just remember
Not a
rice.
hat, yeah.
RICE. You
Okay.
rest, you ice, you compress, and you elevate.
Yes.
Okay.
The
Right.
injuries,
Rest.
Icing.
Ice.
yeah.
Then you compress it with elastic bandage so that to prevent swelling. Then elevate.
Yeah.
Okay.
And also
Prevent
part of
swelling.
that, you have to immobilize it.
Immobilize
diba? So
also.
making hilot is actually moving it, di ba? So parang and
Manipulation.
our initial is immobilize it. Don't move it first because the body's healing. Okay, so if you move it, you're actually aggravating the injury.
Okay, so
But-
wag hilutin.
Yeah, but again, I'll add something. No, it's not always ice.
Yeah.
No, muscle cramps, you don't use ice.
yeah,
It
for
will
muscle
make
cramps.
more the muscle hard stiff. No, you
Yeah,
apply
it will stiffen
some,
it,
warm compress so that
Warm
to
naman.
relax the muscle.
Okay, so,
So
we
that
need
you'll
the muscle.
dilate the blood vessels, let the
Yeah.
blood
And that
flow.
one you can massage. I mean, cramps usually you can
Pwede.
Massage,
no?
uh-huh.
Sometimes you get cramps and you just go like
But
that
not-
and
Yeah.
you're okay.
You
But not
stretch it on the
sprains,
opposite.
You don't massage sprains or strains. You don't.
It's gonna get worse. No?
Initially,
Yeah.
initially, yeah.
Then
So
stretch it
cramps.
opposite the action of the muscles. Yeah.
All right. So we've talked about the ACL, the cramps, the sprains and strains. What other injuries or physical injuries or sports-related injuries should we be aware of, and what should we do when we come across these?
Oh, okay. Well, it depends actually. Well, those are the more common ones.
Yes.
Sprains, strains, but it depends on the part of the body. Like, you get
Maybe
like,
from playing.
Yeah, like for example, badminton. Okay,
Badminton.
it's actually sports specific.
Specific,
Like for example,
yes.
tennis players or badminton players, they usually complain of elbow.
Or squash
elbow.
players, yeah.
Squash players.
Tennis
diba?
elbow.
Yeah, tennis elbow or golfers also.
elbow.
Diba? The golfer's elbow.
Yes,
diba?
yes.
Or so it's sports specific actually.
Even swimming, you
Swimming,
develop
shoulders,
tendinitis, shoulder problems.
Yung mga performing arts, diba? Like for example,
Ballerina.
Ballerina,
Yes,
yeah.
Yes, yes.
Mostly
we get-
knees, hip,
or the toes, diba?
and the
yes.
toes.
Yes.
Yeah.
Those that
Actually, any part of the body.
yes, any part of the body can be
Yes.
rehabilitated, can undergo
Yes.
therapy.
Can be injured and can be
Yes.
rehabilitated. Yes.
Is it expensive to have
It
rehabilitation
depends on the
therapy?
center.
Yeah, it depends on the center. Depends
Okay.
on.
No, actually, they have packages. No? When we talk
Friendly
about
packages.
yeah, when we
As
talk
you
about
say.
packages, like as in St. Luke's, it involves already heating modalities, what we call the pain modalities,
Okay.
the hot packs with transcutaneous electrical nerve stimulation. It's like an electrical wire that is attached to your muscles. It
Okay.
will try to ease the pain, okay? That's one thing. And then you use deep heating ultrasound. It's a pain
What
modality.
does that do also? Does it relax?
Ultrasound.
Yeah, the
Ultrasound.
deep
It
heating.
means heat.
Yeah.
Yeah.
Deep heat. When you say deep heat, as opposed to hot moist pack,
which is
very
superficial.
ultrasound delivers high frequency sound,
So,
which produces
can
heat
penetrate
inside
more.
the body. So you don't feel it on the outside,
So-
but inside there is.
That's
It's
a part
working
of the
inside.
Yes.
yeah. That's the part of package, and then after that, the exercises or the stretching. That's the package. That's what we call package. So
In some
sometimes
centers,
it just
no?
goes 600, 800.
Depends, no?
In
Yeah,
some
it
centers, cheaper. In some centers, more. Okay, and sometimes it depends also on the parts of the body that are, like for example, you complain of knee pain, di ba?
Yes.
So that's just one area. If suddenly you say, Doc, also my neck,
Yes.
you know, so that's another,
It's
that's an
per
additional
area, so
per
to speak,
area.
of the
Tapos
body.
nagustuhan niya yung ginagawa, ay padagdag na tong ganito. So,
Oh, Doc, also my back. Okay.
Buong body na.
idadagdag
Because you really
yun.
want to
So,
feel better, di ba?
because
You
you'll
want to
use the
function,
machine,
function well.
But it's not de kahon. It's not like, parang, oh, this is what you do, di ba? Parang it's case-to-case basis also.
Per
Depends on what the patient is
Yes.
complaining about.
Okay, now we have our Facebook question. Doctors, our Facebook question is, I dislocated my shoulder a few weeks ago. I was able to fix it myself. Do I still need to undergo therapy? Mr. Fix-It or Miss Fix-It?
when he said fix it, I suppose he's fully functional.
Okay.
The range of motion, he can move it on all planes. There's no limitation. There's no pain. As long as he's 100% functional, there's no sensory problem, there's no numbness, there's no weakness, there's no pain.
Okay.
No need
Yeah,
therapy.
that's right. Because if you dislocate your shoulder, and he was able to, the medical term there is reduce. He was
Reduce.
able to reduce it. No?
Okay.
So
Self-reduce.
return it to back to its socket. Okay. Sometimes kasi in the process of dislocating the shoulder, the nerves can get pulled. Okay. So
Okay.
the traction injury. Okay. So sometimes after the reduction of the shoulder, they'll feel, Doc, there's some numbness in my arm. Yun, they should undergo therapy.
Therapy
rehab.
already.
Yeah.
That's-
But
that's
otherwise, if they're okay, they're pain-free, then no need.
Okay.
Baka natsambahan yung tamang
Yeah,
pagbalik. No?
Okay.
Because there are right way to reduce the dislocation.
Or maybe sometimes it happens often and you
Yes,
already
yeah.
know how to
Oh,
fix
that's
it
right.
or
Yeah, it
reduce
happens
it.
always.
There-
You need
there-
surgery for that.
Okay.
Yeah, they're chronic dislocators.
Yes.
Recurrent.
Okay,
We
yeah.
call it
Recurrent,
recurrent
yeah. And that's why
shoulder
parang your
dislocation.
body knows or you yourself know how to fix it already
Yes.
because it happens.
It needs a surgeon already.
And doctors, thank you very much for your time. I'm sorry we're out of time. If there are any last, if there's any message you'd like to send out to our viewers on how to, prevent
Okay. Yes, prevent
or
or
when to see,
address.
address, yes,
you know.
please,
Yes,
Dr.
if you're injured, you get it from a sports injury or trauma, like you fell. Don't hesitate to go to a rehab doctor, and we'll be able to help you. Okay.
Dr. Fernandez, thank you, Dr. Nepomuceno. Dr.
We
Fernandez.
don't have much time, but I just want to add what they should expect during rehabilitation. Because when you're undergoing physical, rehabilitation, it's a process. So we're trying to bring you back to your previous functional capacity. So sometimes you can experience pain on the first few sessions of therapy, but that's just normal.
Okay.
So you have just to go through it. There's a doctor, ask the rehabilitation medicines. We will not prescribe it if it's not good for you.
Okay.
Okay?
Thank you very much, Dr. Fernandez. Thank you once again,
Thank you, Angel.
Dr. Nepomuceno, for joining us tonight. We'll see you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night.